Hello everybody, welcome back to the channel. My name is Dr. Alvaro Raimunde and this is Let's Talk About.
PAK Pediatrics presents.
Today I want to talk about a condition called Clubfoot. I recently saw a patient with this and I thought it would be a really cool video to make so that other viewers are aware and have a little bit more information about what club feet is and how to recognize it, what to do about it, and what it means for the patient. And I want to talk about it because it's actually one of the most common foot deformities that babies are born with. And it can happen on one foot or it can happen on both feet equally. There's a 50-50 chance. So what happens with club feet is that the Achilles tendon, which is the tendon on the back side of the foot, is actually short and tight, and it causes the foot to angle downwards and inwards. So as far as causes, there's three big causes. One is idiopathic, which means we're not really sure what happened. Another one is genetic, and that can be if there's a family history or if it's due to a genetic condition such as Edwards syndrome. It could also be due to a neuromuscular condition such as cerebral palsy or spina bifida. Environmental factors would be if mom smoked during pregnancy or if the mom's belly did not have enough amniotic fluid, which is that fluid that the baby is swimming in mommy's belly. Breech births can also cause club feet. So is club feet a real big issue? Like, is it a big deal? Should I really worry if my kid has a club foot? And the answer is yes. People with club feet can obviously have a really hard time walking. It can cause a lot of injury because of the position of the foot. Now, obviously, this won't be an issue for the baby until they're about 1 year old and start walking themselves. But other than walking, it can cause other issues as well. A lot of these patients can have self-esteem issues. The affected foot is actually usually 1 to 1.5 sizes smaller than the non-affected foot and will tend to be a little bit stiffer as well. In addition, the calf size of the affected foot will be a little bit smaller because that muscle isn't used as much because of the deformity. Now, this is one of those conditions that the earlier we treat, the better. Non-surgically, what we do is, what's most commonly done is what's called the Ponseti method. And in this method, the foot is stretched and then casted. And then it's a series of this. So they'll cast it for a while, they'll remove the cast, refix it, cast it, and so on and so forth. 90% of these patients may still need the Achilles tenotomy, which is where they release the Achilles tendon a little bit to loosen it. After we're done with the casting, the babies are put in 2 little boots with a rod in the middle to keep the position. Now at first, for about the first 3 months, the patients need to be in that boot for about 23 out of the 24 hours of a day. And then slowly after that, we can start decreasing the amount of time that the babies have to wear the boots. The other method is called the French method, and it's very similar, but instead of casting after the stretching, they're actually taped. So these patients have to see the orthopedic doctor about 3 times a week for serial adjustments. And then the parents are taught how to do this at home. And you also still need bracing with this method. Club feet can recur even after treatment. So it's important to keep doing those stretches and those exercises, ideally with a physical therapist. Now, the other way to treat club foot is surgically. But patients with surgical correction of club feet tend to have more complications into adulthood related to very tight ankles. And that's it. That's a quick video on club feet. Hopefully you got some good information out of this. And as usual, stay healthy. I'll see you next time.